Urology of Virginia is a urology practice that is community as well as academic-based. We specialize in oncology, general urology, reconstructive surgery, stone center. In addition, we provide urologic care to the Hampton Roads community.
Reconstructive urology was pretty much started here in Norfolk, Virginia, prior to Urology of Virginia, prior to Eastern Virginia Medical School. This was one of the first practices that started doing this and was one of the pioneers. Reconstructive urology has changed dramatically since it was started. It was mostly men with urethral strictures. Now it's expanded into almost all types of reconstruction, including males, obviously, but females. We look at radiation complications, prostate cancer treatment complications, and it's truly expanded. Our department now has 3 reconstructive urologists that do male and females, and we have 1 that does just females, which is very unique. There's very few private practice groups or departments of urology that have that many well-trained urologists doing reconstructive urology.
Really, it's all about patient care. It's about helping patients minimize their recovery, allow them to get out of the hospital quicker. And we had great visionaries in Dr. Paul Schellheimer and Dr. Jerry Jordan, who were pioneers in these minimally invasive approaches, advocates, and supported our practice in developing these minimally invasive approaches when very few programs in the country were doing it. Such things as laparoscopic surgery, robotics, laparoscopic kidney donation. We were certainly the first programs in Virginia, and in most cases the first program in the Mid-Atlantic, and in a lot of cases on the East Coast, to develop some of these procedures and be involved in the FDA trials for robotics and laparoscopic radical prostatectomy in the late 1990s and early 2000s. And we have a legacy of doing it. We feel it's important for the community and important for our patients.
When I arrived, my subspecialty focus was to be oncology. There was a wealth of material, and I brought from Memorial Sloan Kettering many of the up-to-date ideas at the time with regard to tumor boards, multidisciplinary conferences, the interaction with basic scientists to establish tissue banks and serum banks for future investigations, and also the important incorporation of patients as best possible into clinical trials, so that it was a possibility of keeping on the cutting edge of what was happening in urology with the most up-to-date treatments that were being applied.
I've been lucky to be focused on BPH, or benign prostatic hyperplasia, enlarged prostate. I think having expertise at 1 or 2 procedures helps not only me, but helps the patient as well. So I do a lot of green light laser, vaporizes that benign obstructing tissue, and I do a whole lot of UroLift. It's a minimally invasive procedure for BPH that actually moves that tissue out of the way to help patients with their symptoms. We at Urology of Virginia feel like we're setting an example in some ways, or have a lot of exposure with other groups to see the inner workings. We've been very fortunate to have not only the private practice, the business side of it, but also the academic part. And I think just by being a larger group, trying to continue to grow and having a national presence exposure has put us in that kind of pedestal position. And so we try to really move in the right direction and do the right thing.
It's an incredible heritage and a great history of innovation and a culture of education, but we also have a responsibility as really the sole urology providers for our community and our catchment area of almost 2 million people. And so I think that fusion of the community provider with the academic, education-focused, innovative group is really a special thing that we have here.
What excites me the most is what brought me here 25 years ago is the urology residency, and I think the opportunity to continue to train and develop the next generation. I think Urology of Virginia is a very unique group, and it's allowed us to continue to build that residency. I strongly believe we have one of the best clinical urology residencies in groups in the country.
I am excited about the future of Urology of Virginia because we are going to maintain our independence. And with that independence, you are able to pivot very quickly, you are able to innovate, and you are able to bring the best and the brightest to our community.